Hello, lovely. Hey, it's Dr. NECA, and we changing it up today a little bit. This is gonna be a preview of things to come. Today, I know you're expecting just a regular episode of Victorious Working Moms podcast, but you are getting the Career Mom Reset with co-host Dr. Carmen. Yay! I'm so excited. I said that, but I am legit excited. Like I left my house early because I'm that excited. Okay. So I know Dr. Carmen, but y'all are going to get to know and love her. She actually was a guest on an earlier episode, and I will link that in the show notes. Dr. Carmen is a board certified family physician in the Metro Atlanta area. She is a speaker. She is passionate about the outdoors. She is the original Magnolia Poppy. Check our interview to know what that means. And she is here today because she is passionate about patient education, preventative medicine, helping food as medicine. And we are going to be seeing more of Dr. Carmen as we about to make some changes to the podcast. So everybody, yay, Dr. Carmen, welcome, welcome, welcome.
Thank you. Good morning.
Good morning. I know y'all are booked and busy, and so are we. Dr. Carmen is also a wife and a mother of two. So she got her hands full and she worked full time. So y'all, let's lean in because we're about to talk about something that is important. But before we get started, I got to review the nacho rule. Nacho rule means we nacho. We are board certified physicians, but this is not a substitute for seeking out health care and mental health care for that matter. We are two physicians operating our zone of genius, kicking it, giving you the edutainment, educational and entertainment, but it's not a substitute for healthcare. We won't bill you. We're not filling out FMLA. So I just got to give that disclaimer and let's get started.
All right.
So Dr. Carmen, you were telling me about that we have the Minority Mental Health Month.
Yes, July is Minority Mental Health Month, where especially people in minority ethnic groups, it gives them opportunity to become more educated about mental health barriers, and hopefully during this month, people can be encouraged to seek help for their mental well-being.
Now, this is important for everybody. So if you're like, well, I'm not sure if I'm considered a person of color or minority, mental health is something we need to talk about. And it looks different in different populations. So in healthcare, how it shows up with who you work with. So it's a topic for everybody. But in the minority mental health, I would imagine when you're not the majority, when you're kind of, as I say, the speck of pepper in the salt shaker, a lot of times you feel like you have to perform, and it may not be easy to express what's going on, or your cultural norms may not talk about mental health. So if we're really trying to be inclusive and tolerant, we gotta, if it's not your population and you're listening, it's something to learn. And if you're in it, sometimes we got to see about ourselves. Would you agree?
I totally agree. And it's absolutely something to learn. If you're not a person of African descent, of Latinx descent, of Native American or Asian American Pacific Islander descent, surely you work with at least one person, unless you're in a really isolated area. And there's some isolated areas like that in Georgia, but chances are you work with one person of that ethnic group. And I was always taught never be around someone that's different than you and not learn something about that individual, be it what they eat, the clothes they wear, how they respond to different things. It's just so important to understand and be educated about people who are different than you are.
Absolutely. So it makes me think, what are things that we need to be looking out for? Like when we talk about mental health, just speaking as a person of color, of African descent, it's kind of a taboo topic. And I would imagine this is why we need the awareness. Like, um, people don't like to admit that they're depressed or anxious or may not even be aware of it, or in seeking out help, they don't want to be misunderstood or labeled. So, in this month, what are things that we should look out for, the signs that maybe our mental health is, maybe we're getting stuck in something, maybe it's time to seek out help? And who
Absolutely.
do we seek that help out from?
Your primary care physician would be a great start, to be honest with you. I encourage my patients to get physicals, even though now data has shown that there's not really any need for the annual physical. I always tell people it's good to just have a check-in with your physician. And as a primary care physician, I always hear from my psychiatry colleagues about how backed up they are. And honestly, family medicine physicians are trained to see patients and to screen for depression, anxiety, and certain other mental health conditions as well. And definitely with depression and anxiety, we can also begin to even treat some of those conditions as well, as that is within our specialty scope as well. So that would be a good place to start. If it has been more than 12 months since you have seen a doctor, go ahead, make that appointment, get your checkup, and during that time, your family medicine physician, which hopefully hope you would see a family medicine doc. I advocate hard for my specialty, as many people know, will actually do a screening for depression and maybe even for anxiety as well. And if they don't, it could be a slip of the mind. That's okay. Don't hesitate to be like, hey, do you mind screening me for depression or anxiety? Don't hesitate to ask your doctor about that. We enjoy when our patients are forthcoming and communicate with us.
That's an important point. It's, mental health is part of your overall health, and we tend to be more accessible than maybe say our psychiatry colleagues, and it is a part of health maintenance. A lot of people feel like, well, folks is busy, and what do I do? And I think I'm okay. What are also, or this is some signs that you see if you can add to it, Dr. Carmen. I'm also a family physician. I used to work in the urgent care environment. So sometimes I'm seeing when people are in crisis or distress, or
Mhm.
the reason of the appointment may not be clear cut of I think I'm depressed. It could be I'm tired, I have back pain, I have an upset stomach. A popular one is I need a stress leave. And the lady in HR said, I need to give you this. Um, Sometimes it's after an ER visit for chest pain, and they find out they're not having a heart attack, but what's going on. So sometimes what leads people to primary care, to family physician, is not always clear cut. They're not aware of what depression or anxiety is. They just know that something's off. And usually once it gets to the body level, somatic level, physical symptoms. So that's what makes it hard to tease out how to help someone recognize I might be depressed, or I might be dealing with anxiety, or my mood may not be shifting.
And sometimes I kind of take my medical experience for granted. It's been what, 10 years now since I've been practicing as an attending physician, 13 years since I've officially become an MD. When I hear those somatic symptoms, those physical symptoms, I ask people, hmm, is there any possibility you may be depressed? Now it's just knee jerk. I just ask them, are you anxious? Are you stressed? I mean, I actually use those phrases. And if they're like, no, I don't think so, then especially if it's not during a physical visit. If it's during a physical visit, more than likely I've already screened them. But if it's not during the physical visit, and I'm like, you know what? I tell them, I have a questionnaire for you. I said, so just bear with me, and I'm going to walk you through this questionnaire, and I will sit there and do that with them. And when it actually does show a high, if they screen high for depression or anxiety, they're usually shocked. And I'm like, this may be hard for you to come to grips with. Especially, I've noticed more of my Latinx, my Hispanic population, they actually tend to present more so with somatic symptoms than other populations. And it's just it's a hard pill to swallow for them. And it's like they're convinced that it's just something physical. And then I let them know, especially in the area of stomach pain too, outside of the central nervous system, the largest, I guess you could say, neurologic system is actually in the gut. So when people talk about, I have a gut feeling of X, Y, and Z, they talk about having butterflies in their stomach, stage fright. What happens? People have stomach cramps, people have diarrhea. That's your nervous system talking. And it may not necessarily be in your head where you feel the depression or the anxiety, it may be in your gut.
Absolutely, Dr. Carmen. And this is not to stereotype anybody, but if we're not aware that everything's not textbook, and a lot of times people don't have awareness, the pace of life, it's so busy, getting curious is, when I have this stomach upset, what's going on? When I get headaches, what's happening? That helps. And really a good clinician should be asking those questions too, because part of understanding what's going on with your health is what sleep, how much sleep are you getting? What's going on in your life? And sometimes it's not, would you agree, Dr. Carmen, it's not just what's happening right now. Sometimes it could be the anniversary of an event. I know
Absolutely.
grief is not talked about a lot, and people could be feeling anxious because something is coming up. And then some kind, and we're not faulting anybody. It's not a fault thing. It's not a judgment thing. It's about recognizing and being aware of what's going on in our bodies. And I don't know if it's technology or the pace of life, or we just don't teach people, like people seem disconnected with their body. Like, I will have someone tell me all the things that's going on in their life, and it's like, well, do you think the headache or the stomach pain has anything to do with it? I never thought about it. Well, you're telling me that you're working a second job, you're going back to school, you're taking care of your niece and nephew, you're very active in your church, you just broke up with your significant other, and you're planning to move. Those sounds like a lot of things that could be stressful for people. Would you
Absolutely.
think you're And they're like, oh, absolutely not. Like, we expect ourselves to be robots or something. It's like, you're human. And being a mother, being a professional, being a minority, you're still human. You're
Yes.
still human. Mm-hmm.
Yes. And definitely also making sure that you're treating your physical, your spiritual, and your mental health. I can speak for my Black people as a Black woman, as a Black doctor. We will see the doctor if something hurts. We will talk to our priest. We will talk to our pastor. We'll talk to our imam. We will get on our knees. We will hit the prayer rug, our altar. We will pray. But when it comes to mental health, we tend to want to group that with spiritual health and treat that spiritually, as we should. Prayer is good if you are a believing person, if you're a person of faith. Nothing against prayer at all. As a matter of fact, research has also shown that people who have physical ailments, actually, the healing process is expedited if you have other people praying for you and if you're praying yourself. So that is nothing against spirituality at all, but mental health does need to be treated as mental health. And if someone wants to pray or send good vibes or good thoughts along with that, then that's okay also. And mental health treatment can range from speaking to a licensed professional counselor who may or may not be a person of the cloth, to medication even, and that is okay.
Absolutely. I agree with you, Dr. Carmen. I think it's very important to normalize that, it's normal for people to be sad, mad, angry. I think the issue is when we get stuck in it, and then some of it is modeling, some of it is what's easily accessible and what's socially acceptable. But sometimes it's because someone is a religious teacher doesn't mean that they always know the nuances of managing and treating and diagnosing a mental health condition. So you can pray and take medication, pray and go to therapy. And let's talk a little bit about therapy. As
Mhm.
primary care physicians, sometimes people get taken aback when we suggest, maybe you need to go to therapy. Well, why can I talk to you? I mean, you seem friendly, especially if it's a fellow minority. It's like, I don't be telling no
Mhm.
stranger my business. You get what I'm saying. Are you trying to push
Yes.
me out from? One, that's a boundary issue. If I know what my zone of genius is and how I can best serve you, I'm trying to advise you that the urgent care may not be the best place because you need continuity in this. And then there might be somebody that's more specifically trained to help walk you through strategy, coping, unpack the layers, especially if it's trauma. Well, I could just talk to my friends and family. Yeah, but they're not trained professionals and they have an emotional investment in you, so that they may not be able to be objective. And our friends and family may not know what bipolar or borderline or schizophrenia or things like that are. And yes, you could be a Bible believing, you could be a faithful um, Muslim or person of faith, and you can still have mental illness. It doesn't mean you're weak, doesn't mean you're evil, doesn't mean you're cursed. It means you're human. It means
Right.
you're human. But the therapy talk, especially when you're a minority healthcare provider and you might be speaking to fellow minority about therapy. How do you address that? And do you advocate for therapy? Sounds like you do.
Oh, totally advocate for therapy. I've had that situation multiple times in my practice over the years, actually, where at the end of the office visit, oh, I feel so much better, Dr. Eccles. Can you be my therapist? Nope, 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 nope. I cannot be your therapist. I can treat your cold. I can treat your diabetes, give you medication for the depression that you have or the anxiety that you have. However, there are people who are trained in therapy. Cognitive behavioral therapy is one that a lot of licensed therapists use. I do not have training in cognitive behavioral therapy. You need to find someone who has training in that area and see them. And they will may be able to determine also if cognitive behavioral therapy is not even right for you. There are people who have that area of expertise, and I'm just not that person. And I believe in your whole health, and your whole health includes your mental health, and therapy is a big part of that. And one thing that a lot of my patients know about me as well is I won't just say, okay, take this pill and go on your way, because mental health is so much more than that. Like physical health, for instance, with high blood pressure, high cholesterol, diabetes, my bread and butter, I love to treat all three of those. I'm not going to just give you your blood pressure medicine and say, okay, go swallow this pill, but you're continuing to eat high sodium foods. You're not exercising, you're remaining sedentary and things like that. It's not going to be as effective if I just give you a pill and that's all. Same thing with mental health.
Absolutely. And I think I agree with you now. Although that takeaway is like, especially professional moms, we got too much going on not to take care of every aspect of our health. And often we are the go-to person for people. Where do you get to go to? And we hold things in. So you may hold things in because I don't want nobody to know my business, or people look up to me, or the position that I'm in. Well, look, we're two board certified physicians telling you that it is healthy to go to therapy, and things don't have to be falling apart. Sometimes it's helping to build coping skills, strategies, making sure you have a way of building your mental hygiene, checking in on yourself. I'll say for me, therapy has been very helpful in working through um, boundary work. How do you keep it going? You see people that do all the things and have it all. You got to be very clear in with the people in your life on what you can do and what you can't do. And that takes practice. So sometimes therapy is almost like mental, physical therapy in that you're practicing building that muscle on how and resilience and how you cope with things. And we do want to talk about trauma because there can be big and small traumas, like being in an accident, losing a loved one. I think sometimes dealing with sexism, racism, there's also consider you micro traumas, the microaggression of being in a toxic work environment or being in an uneven relationship. Like everything isn't all or nothing, stay or get out. But as we grow, especially as professional women, we're being put in a space that wasn't built for us, that might be new to us, and how to cope with that. I think a therapist, personal. I had a nurse practitioner I worked with that said she told her husband, "I need a nanny, a therapist, and a personal trainer."
I know that's
That's what she
right.
told her. Like when you are in high places, you have to have a team. And I think therapy and coaching and your physical health and who helps you with your money, all those things it's just smart. It's true prevention. So it's like, well, I could tell my friends, but they don't know how to recognize when you might be getting triggered, traumatized, how to help you. It's gently pull back the layers, how to be assertive in that workplace instead of venting on the internet, because we do it. People have been on the
Hmm.
internet. It feels good to tell thousands of strangers, can you believe what happened? But be getting able to be honest with the emotion of it and even practicing how am I going to address this personal issue with somebody that is not going to take you too far and is knowledgeable on how to keep you safe while you're trying to manage changes. It's important. So what we're saying is if your physician suggests getting the therapy, they're not pushing you off. They're trying to lift you up. And sometimes people aren't ready and they want to dead end. This is what my social worker friend said. They're dead ending. You want to stop with the primary care because it feels comfortable. You're not really ready to fully deal with the problem. It's similar to when a physician is advised and sent you a consultation to a surgeon. They think you need surgery. And you keep coming back and say, well, why isn't my problem getting better? You haven't taken that next step. And sometimes it's scary. But when you know that other people are also going to therapy, it kind of normalizes it. I think the younger generation, like the Gen Z down, they're probably it's less of a stigma. But I
I
think for like
agree.
maybe older millennials, Gen X on up, it still kind of is.
Because we're expected to be superhuman almost. You work hard, you put your nose to the grind and just go at it. If you feel tired, you're not supposed to say anything. If you feel stressed, you're not supposed to say anything. Admitting fatigue, admitting stress, admitting exhaustion, admitting just basically, you know what, I'm doing too much. I just can't handle it. It's almost like it's a sign of weakness. And it's not. You're human. You're not a machine. It's not a sign of weakness. It's okay to reach out and get help. And I totally agree. I'd probably say what I'm a zennial, I guess you could say, right at that cusp between a millennial and a Gen Xer. I was going to say zennials on down are actually doing better with their mental health. I agree with that.
Now, I think the whole social media thing can be a plus and a minus. Um, so and it's okay to make an appointment, just I'm not feeling it right. It doesn't always have to be you don't have to pretend you're here for physical. Like we get it,
Hmm.
and you actually get more of our time if we just cut to the chase. But I feel more irritable, I'm tired, and if we can't cut to the chase, we're here to help. We're trained to take a history of physical to kind of ask court probing questions to get to the meat of the matter. So you don't have to beat around the bush with us. And if you need to write it down, we've read a lot. So we learn how to read fast. So what I'm saying is don't feel shy. We're aware, especially if you're a person of color. We're extra aware. Our radar, our spidey senses up that we know it's hard to get in, it's hard to admit, and it's hard to talk about sometimes with friends and family. A resource is actually one of our fellow Xavier University alum, Dr. Joy Hardin Bradford, has a wonderful resource, Therapy for Black Girls. It's a podcast and it's a directory. So you can find mental health professionals, therapists around the country. I know I've used that resource to help my patients, and I'm based in the St. Louis area. Another resource is Psychology Today. You can put in literally your insurance, what type of, you say, I want a Black female therapist in such and such zip code that does EMDR. Boom, you can find it. Like Dr. Carmen said, cognitive behavioral therapy is one type, but there's other types where you don't have to talk about what's going on because I'm like, I don't want to talk about it. You can work through it. There's so many different ways where you can process memories, play therapy. You can just sometimes just get guidance on how to manage the discomfort of like not being a people pleaser anymore or confidence, how to manage sexual harassment or speaking up for yourself, the emotional part of it. And the emotional part of it is affecting your physical health, hence why you started talking to us about it in the first place. Um, we did want to mention a little bit as the time draws near um, about social media and the effect on mental health. I want to say kudos to the Instagram and the therapists, especially those of color, that have really put themselves out there and post quality stuff on social media. It really helps to break the silence and help people to see themselves. Like Nidra Tawwab has this amazing book about boundaries. I'm gonna have to put that in the show notes. You see yourself and now, but don't judge yourself. And it just opens the door. So if you're like, ooh, I don't know about therapy, then maybe up your podcast, your YouTube, your social media followings, at least just to start getting the brain to normalize and recognize it until you're ready. But sometimes we got to go beyond our immediate circle just because sometimes they're too close to us, especially if you're in a high level position. You need to, you gotta up level, or else you're not going to be able to manage what's all going on, and it's going to affect your physical health anyway. It
Yes, it
can be
will.
very affordable, it can be very discreet. Telehealth is on the rise. um and it can affect also not just if something bad's going on, but your health. Like you mentioned, things like a new diagnosis of diabetes, of cancer, of hypertension, transitions in life. I see myself as a healthy person, and now you're telling me I got to take pills. Sometimes that's a lot
Yes.
to manage. Or the fear of, we get to a particular age. Some people are afraid about, well, what are my fertility options? Or um, should I make a decision of getting my tubes tied? Those are actually a lot more stressful than people realize. And it's good to have a team of people. We're part of the team as your healthcare professional, but we can't be the only person.
And also too, moving even to older people, I've noticed too, we're living longer. And many of us, not all of us, but many of us are living healthier lives and living longer. But then you see your peers whose lives weren't so healthy and they're dying before you. And basically your friends are dying. You're losing people to talk to. You have that in the back of your head of, okay, am I next? When is my time coming? As you watch people your age and older die, and you're like, wait, so I'm being left behind. That can actually, I've noticed that actually working a toll on some of my senior population as well.
Yeah, absolutely. Also, Dr. Carmen, I was just wondering with minority mental health, we talked about, yes, there are persons of color that are in healthcare, they're in mental health that can help. How does it go with supporting people, one, when they're starting to take medicine and go to counseling, but maybe people in their life are like, why are you doing that? Well, can't you just do da 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 da?
I don't know if this is the right thing to do, but this is what I tell my patients. Anything that goes on in this exam room, this is your business. If you want to, I believe in telling at least one person that you trust and you feel will be supportive that you're on a new medication in the event that you experience side effects. So at least one person knows if they have to rush you to the hospital or something's going on, or they have to bring you back to the clinic, they'll at least know something. But for the most part, I tell people, unless you decide to go and tell the world, it's nobody's business. This is your business. This is your health. Be prepared to tell other people whenever you are ready. If you don't want to rush and tell the rest of your family members at this time or your close friends because you're afraid that they may discourage you, they may stigmatize you, but be well meaning in the process, but still discourage and stigmatize you, then don't tell them. It's okay. But find that one person you trust if you're on a new medication and let someone know. And
Absolutely.
usually my patients are okay with that.
And give the medication a try. A lot of medicines, it takes weeks to see the full effects. So sometimes people are like, ooh, I passed gas first night on this medicine, it didn't work. And please talk with your healthcare provider if you're concerned about, or healthcare professional, if you're concerned about side effects. One, that should be explained to you, but sometimes yours might be different than somebody else's. And protecting your mental health. Um, we're mentioning it as Health Month. Sometimes we want to tune out, and I know we're in that woke culture, but I would say there's some things I don't watch. I don't let my children watch on social media, on the news. I want to protect my emotional well-being. I don't like, for me, I call it the trauma porn. I don't need to see people take their last breath on television. I don't, if I feel like the conversation is too disruptive to my mental well being, I decide I'm going to take a pause on that. Like, we get to be joyful. I don't have to always be going through trauma, seeing people laid dead, things like that. There's a lot that comes out of us on social media, the news, what people talk about, and sometimes protecting our mental health is saying no.
And I really appreciate that last summer, especially with George Floyd plus. I'm just
Yeah.
call it that. It was George Floyd plus
Yeah.
last
Yeah.
summer. Um, that was honestly, I know it's really bad to say, but I unplugged from social media so much, I stopped watching the news. And my daughter actually said that my favorite television show was the news. She actually told her teacher that. I'm like, ah, great. So I actually stopped watching the news. I unplugged from Facebook. I would watch the weather. I may watch the local news, and then that would be it. It was just too much. And I was a better person. I was a better mother. I was a better physician for it, to be honest.
Right. I agree with you. And oh, I hate that I got to round this up. It's just this daggone ding dang job. But I think we've covered on some things. One, get your mental health team, work on mental health hygiene, and those are things that if you're, need to reach out, hey, DM me. I'll put our information. If you're like the mental hygiene part, I'm not sure. Or how can I talk to my doctor about this? I'm not gonna give you I'm not gonna tell you to take 2 of these and come in the morning. But sometimes just getting awareness of something's going on in my body, something's off, and I'm just not sure. Let's at least help steer to some resources. But if you're also interested in what about food is medicine? Do I gotta take a pill? Or I do have diabetes and I feel a bit down about it. How can I still thrive and not just survive? Hey, Dr. Carmen is a great resource. To follow her on Instagram, on Facebook. If you love what Dr. Carmen has shared with you and you would love her to speak virtually or in person to your group or organization, I will include her contact info so you can hit her up. Um, we need more of us in our voices. And as career moms, as professional women, we want relatable, reliable information. We want to be able to take actionable steps and we want to be able to set a good example so we can change the culture for the next generation. Would you agree?
I agree totally and completely.
Yes. So y'all give us feedback. We want more of Dr. Carmen, but hey, you got to let us know what you want us to talk about. We don't want to just give you drive. This is such and such month. We want you to be empowered so you can go, grow, and glow. So thank you so much, Dr. Carmen, for coming in. You're gonna see more of her. Please listen, share this, open that conversation, book that appointment if you haven't been. You're paying for the insurance, you might as well use it. And if you're like, I want more of y'all, more of this, please reach out to us. So, Dr. Carmen, can you briefly drop your social media deets for those that are listening?
Yes, you can find me on Facebook, Instagram, and LinkedIn at Dr. Carmen Eccles, and that's Dr. Carmen Eccles.
Absolutely. Well, this was a fun time doing a career mom reset. Like, takeaway is you're human. It's okay to feel your feelings, and it's okay to seek help. And the help might be a variety of things. Yes, you can pray and take medicine, go to therapy. It may be for a short period, it may be for a longer one, but tending to your emotional, mental well being will help boost your health and give you that energy that you need. And sometimes the best answer is no. Sometimes the answer is no. All right, follow me and Dr. Carmen. This has been the Career Mom Reset. Thank you, thank you, thank you for listening. Please share. Have a blessed day.